that presented with this ventral neck mass right here that's been diagnosed as a sarcoma, but on the CT scan preoperatively, we discovered a thyroid mass, which I can feel right in here. So chest scan was clear. We contacted the owners. They were happy to go ahead and take out the thyroid mass. Now, thyroid carcinomas most likely is what we're dealing with. And they have a median survival time of about 3 years. And this is a 13-year-old dog. The thyroid mass should not affect this patient's longevity at all. If you haven't already done so, please subscribe to our channel. Make sure you turn on notifications so you'll get a ding in the phone the next time we live stream. This dog is breathing up a little bit. It's just making a bit more effort. So if we could just watch the anesthetic level, maybe give it a little bit more Alfax. Got my Gelpy retractors in here. Incidentally, going forward, I'm probably just going to start streaming just to Vet Dojo because I have purchased James's half of Vet Dojo, so now I am in charge of the whole channel. And so I will probably just start streaming to Vet Dojo going forward. So midline approach here, and then I'll divide the sternohyoideus in just a second. So that's sternohyoideus there, and I can see the median separation between the two sides. And I always go midline on these guys. I very rarely am going to go paramedian because it's just so much easier to see and to look for symmetry. Plus, I'm not having to cut through any muscle. So my mass is just going to be right down in here. And I am going to have to be careful with the recurrent laryngeal nerve and vagus sympathetic trunk. So that's the mass sitting right there. It's actually smaller than I anticipated based on the CT scan. It definitely looks like it's likely to be a thyroid carcinoma. So better to get it out early before it gets invasive. So I'm not sure if you guys can see that right there. So jugular vein is actually much more superficial. The carotid artery is going to be closer to the mass. So that's the mass sitting right there. All right. And jugular vein, you really don't have to worry about at all. You can ligate that without any concern whatsoever. Cindy, my intern, is off studying So I'm on my own today. I could have had a nurse scrub with me, but I think I'll be okay. So there's no problem if you sacrifice the carotid artery either. On one side, if you have to sacrifice both, you certainly can do that, and I've done that before, but you can have some neurological deficits if you do sacrifice both of them. That's the parathyroid right there. So the parathyroid, because we've got 4 of them, I'm not worried about hypocalcemia in this patient. If I were to sacrifice all 4, for example, if I had bilateral, there's another parathyroid right there. I don't know if you guys can see that, just at the tip. A little bit of a bleeder right here. So that's the mass removed right there. Just lay it down for you so you can see it a little bit better. I don't typically temporarily ligate the carotid artery unless I'm doing a big maxillectomy. Even then, it's uncommon for me to do that. Can I please get some 3.0 PDS? Just tie off these arteries. So the biggest prognostic factor with thyroid tumors is the movability of the mass or mobility of the mass. So for mobile thyroid carcinomas, the median survival time is 3 years, and with fixed thyroid carcinomas, it's only about 8 months. I'm just going to try to remove this hemostat and see if I can be a bit more specific with what I've clamped. I think we're actually okay there. Just have one more little look. All right, my recurrent laryngeal nerve is going to be all the way in here. So that's it right there. I don't think you guys can see it because it's kind of dark. Hola, Mexico. In Germany, Irina. I will not test thyroid hormones because I'm just removing one mass here, and most thyroid carcinomas in dogs are non-functional, and so checking thyroid levels is not a standard part of the workup for thyroid carcinomas in dogs unless they present initially with clinical signs of hyperthyroidism and then the mass is discovered incidentally. So I'd say probably 95% of thyroid carcinomas in dogs are non-productive. Can I get a formalin pot, please? Yeah. Let me just hand that off before I forget so I don't chuck it in the bin. So again, going forward, I am just going to be streaming on Vet Dojo, not on Vetalign, just because I own the whole channel now. I bought that off James. So I'd like to concentrate my efforts. So I'm doing just a little sub-Q closure here. Another one watching from Mexico, Alejandra. Can I please get some 3O something on a cutter? If there is anything, if there's not, I can just use this suture. No, that's all right. Oh, good. Thank you. So I'm heading up to the Green Cross conference this Thursday. So Green Cross is the corporation that I work for. And they have a huge conference every year. Number of attendees, probably about 2,000 attendees. Maybe not quite that many. And so I'm lecturing on second victim syndrome and also on hind limb lameness. And then I'm doing a workshop. Can I get another 3O PDS, please? Doing a workshop on soft tissue surgery. I'm going to come around the other side of the table. So any of the non-steroidals are fine to use with paracetamol or acetaminophen in dogs, and we use them commonly. Favorite is meloxicam, but any one of them are okay, as far as I know. So I've switched sides on you. I'm not sure if you guys can tell that I've switched. But the dog's chest is getting in my way a little bit of my suturing. And stay tuned, because we are going to remove this little soft tissue sarcoma as well. Can I get a permanent marker, please? Thank you. And the courses that I had on Vet Dojo that we've closed registration on, I will probably open that back up in the coming months. Sadly, this is my only surgery for today. And another dog that came in for a TPLO, but it had been fed this morning. Since it was an emergency, we decided to put it off. And then I had a cat come in, potentially electric chemotherapy, but there's an international shortage on bleomycin. So we're going to use cisplatin instead, which systemically cisplatin is highly toxic to cats. But if you use a smaller dose intralesionally, along with electric chemotherapy, that's okay. It's nice to see that you guys are watching this surgery on the big screen in theater. I don't know if I told this story before, but my son, my youngest son, was at a party early in university, and he went downstairs. And there were like 5 of his friends, probably in different degrees of inebriation, watching my YouTube channel at about 11 o'clock on a Saturday night. One of my proudest moments. So I'm surprised they don't heckle me on my channel. I'm close with most of my kids' friends. and they would feel very comfortable with heckling me. Yeah, so we do shave the site, and then we do a chlorhexidine scrub, and then we do an alcohol wipe, and then we do a chlorhexidine spray just before we start cutting. All right, so finished with that site. Now I'm going to come around back to the other side. And can I get the table up just a little bit, please? All right, so this is our sarcoma, and it's completely mobile. So I'm probably just going to get, that's great, thanks, about 1 centimeter around it. Alright, so in this area in the neck, there should be plenty of skin to close. So I'm just getting my 1 centimeter margin here. Grab another lap sponge. Might encounter the linguofacial vein on our journey here today, but that you can definitely sacrifice. I'm just there's a little branch here that I'll hemostat before I cut it. So that's jugular vein sitting right there. That's linguofacial and maxillary, and then that is a branch of the linguofacial vein. So I'm just trying to get a hemostat around that before I cut it. Okay, so that's our tumor right there. So yeah, the first mass was a thyroid carcinoma. There's a question about the electrosurgical generator that I'm testing out. We're working on a new algorithm for it to try to improve the speed. It's a bit slow right now. for security's sake, the manufacturers have made the ligation time 12 seconds, and that's a bit slower than what I'm used to, and so they've got a new algorithm for me to test. And so I just need to install the new algorithm. And I have lost my ligature. I might have lost my other 3.0 PDS. Could I get another one, please? Sadly, the septic abdomen passed away after surgery. It was just very, very ill the time we operated, and I think it actually died on recovery. A question about Julius Liptak and live streaming. I'm not sure what his channel name is, but I don't think he live streams as much as I do, but he definitely does do some. He's a really good surgeon. He's probably more active, or used to be more active on Facebook. With, I think, Animal Cancer Surgeon was his Facebook page, and he would review a lot of his cases. So basically what I'm doing here is I'm going through and splitting the distance with each of my suture bites. Let me see if I can get this a little bit better centered. Here we go. So piroxicam has a much greater complication profile compared to the other non-steroidals like meloxicam and carprofen and stuff like that. And so I only use piroxicam for its anti-cancer effects, and so I'm going to use piroxicam for transitional cell carcinoma. That's the main one. But if you're just using an non-steroidal for its anti-inflammatory properties, I would recommend going with meloxicam or carprofen or Onsior or something like that, which are going to have fewer gastrointestinal issues. I'm going to start on doxycycline on this dog. So piroxicam is great for transitional cell carcinomas. That's what I use it for, and that's almost exclusively what I use. Although some medical oncologists now are recommending meloxicam instead of piroxicam for those cases. Can I please get a 2.0 PDS? Regarding whether there's a big difference between piroxicam and meloxicam or the other non-steroidals for transitional cell carcinomas, I really can't comment. Most of the research to date has been done with piroxicam, and I know that a lot of medical oncologists say that that research is coming with meloxicam, but I've been hearing that it's coming for the last 5 or 6 years, and I haven't seen any data. So until then, I will probably stick with meloxicam. Again, a lot of medical oncologists are happy to use, I'll probably stick with piroxicam, but a lot of medical oncologists are looking or consider using meloxicam instead because of that lower risk of gastrointestinal complications. Typically with meloxicam in cats and dogs for postoperative pain, we're probably kind of looking at 5 to 7 days generally, unless you've got a chronic pain situation, in which case you can use it longer. Just if you're going to use meloxicam long term, you really should be screening blood work to look for renal toxicity. And JK, you just said that you typically only use meloxicam for 3 days. What's the rationale for that? And using carprofen for longer. So I don't think there's any difference in this complication or side effect profile between those two medications. So I'm just wondering what your rationale is for using meloxicam for a shorter period of time. Guys don't normally get to see me suture. I usually have left Cindy in charge by this point. Now in this little isthmus between the two incisions, there's a chance that I'll get necrosis there. There's not a lot I can do to avoid that, and there's not a lot that I could have done to prevent it with my incision, because they just anatomically, that's where the incisions had to be. So it'll be interesting to see if we have any issue with that. I will go back when I'm finished and make sure that I've answered all of your questions, but I'm not really looking up. Yes, I'm just finishing up here, Sam. There's a question from Alejandro about how I have the discussion about cancer with owners. And basically, I mean, I'm just going to be very transparent and objective about what the survival times or predictions are with the different types of treatment and the different types of cancer and stuff. And my key thing here is not to make any decisions for them, but to let them make the decisions on their own or with my guidance. But I'm not going to push them in any direction. And depending on the cancer that I'm treating, I'm going to be variably optimistic. Also, to some degree, with my experience and issues with complications, metastasis, stuff like that. And I'm going to let that direct my recommendations. But I'm, evidence-based recommendations and informed consent are really important to me. So I don't want somebody coming back and telling me, oh, I wish I hadn't done the surgery. I wouldn't have done it if you had given me more information or if you had given me different information or whatever. So I'm always trying to give the owners as much information and then obviously documenting all of that so that they know exactly what they're getting into and they can't come back to me and say, look, you never told me this, or if you had told me this, I would have made a different decision. All right, so that's pretty much it. I'm just going to go and look at the chat and make sure that there aren't any questions that I haven't answered. So just give me a minute to get to the streamer. Yeah. So I'll just go back to the beginning here. So hi from the Philippines, hi from Newport Richey, Florida, where we were not very close to the jugular vein. Hi, Zephyr Hills, Florida. We can definitely sacrifice the carotid artery. Hi, Germany. Hi, Mexico. Another Mexico, Florida. Hi from Brazil. So I did not inject subdermal bupivacaine. That probably would have been a good idea. We might still do that. I will go ahead and do that. Thank you very much for reminding me. Bassem. So I will go ahead and inject the subdermal bupivacaine. And Wisconsin. So I think I've got everything else. Yeah, so if you guys haven't already done so, please subscribe to our channel. It's interesting to note that only about 30% of viewers are actually subscribed, and so it'd be really great for you guys to subscribe if you're watching, because then you will get a ding on your phone the next time we live stream. So thanks a lot for watching, and we will talk to you soon.